Imagine waking up with a high fever, red eyes, and a relentless cough, thinking it's just a simple cold, until your skin erupts in a rash spreading like wildfire. Measles is one of the most contagious and dangerous diseases, yet many still underestimate its risks. But can it be stopped? Let's find out. Welcome to Levitas. What is measles? Measles is a highly contagious viral infection caused by the measles virus, or MEV, a paramyxovirus that attacks the respiratory system. Once inside the body, the virus rapidly multiplies in the throat and lungs, then spreads throughout the bloodstream. It primarily affects children and unvaccinated adults, causing severe inflammation and immune suppression. The virus spreads through airborne droplets when an infected person coughs or sneezes, lingering in the air for up to 2 hours. Without immunity, nearly 90% of exposed individuals will develop the disease. Though often seen as a childhood illness, measles can lead to serious complications, even in healthy individuals. How contagious is it, and how do you get it? Measles is one of the most contagious diseases on Earth, even more infectious than the flu or COVID. It spreads through tiny airborne particles, infecting anyone who breathes them in. Even without direct contact, you can catch measles just by entering a room where an infected person was hours earlier. Unlike some viruses, measles has no animal reservoir, meaning it only spreads between humans. Once inside the body, it hijacks immune cells, disabling the body's ability to fight infections. Because measles wipes out immune memory, those who recover become vulnerable to other infections for years. Without immunization, outbreaks spread like wildfire. What are the initial symptoms? The first symptoms of measles appear 7 to 14 days after exposure, beginning with flu-like signs that people often mistake for a common cold. The measles virus first infects the respiratory tract, leading to high fever as high as 104 Fahrenheit or 40 degrees Celsius, as the immune system reacts. Runny nose and sneezing, triggered by viral irritation. Red, watery eyes, or conjunctivitis, due to inflammation in the mucous membranes. Dry cough, caused by viral damage to the throat and lungs. Fatigue and body aches, as the immune system fights the infection. One of the most distinctive early symptoms is Koplik spots, which are tiny white spots with a red halo inside the mouth, appearing 2 to 3 days after fever onset. These spots are a hallmark of measles infection and signal that the virus is spreading rapidly through the body. The virus replicates in the lymph nodes and bloodstream, leading to systemic inflammation. As the immune system weakens, the body struggles to fight off secondary infections, increasing the risk of complications. Within days, the full-blown rash appears, marking the next stage of the disease. What are the later symptoms? By day 3 to 5, the measles rash emerges. This is a red, blotchy eruption that starts on the face and behind the ears, then spreads downward to the chest, arms, and legs. The rash is caused by the immune system attacking virus-infected skin cells, which leads to intense redness and inflammation, often covering the entire body. Severe itching, as skin cells are damaged. Swollen lymph nodes, a sign of the body's ongoing fight. Loss of appetite and dehydration, as fever persists. At this stage, measles suppresses the immune system for weeks, leaving patients vulnerable to bacterial infections like pneumonia or ear infections. The rash typically lasts for 5 to 6 days, then fades, but the immune system remains weakened. Some people may develop encephalitis, which is a brain inflammation that could lead to seizures, confusion, and even death. Because measles erases immune memory, even after recovery, the body may forget how to fight previous infections, increasing susceptibility to other illnesses. This is why measles is far more dangerous than a simple rash. What are the complications? While measles may seem mild in some cases, it can cause life-threatening complications, especially in young children, pregnant women, and immunocompromised individuals. The most serious complications include pneumonia, which is the leading cause of measles-related death, occurring when the virus weakens lung defenses, allowing bacterial infections to take over. Encephalitis, this is a deadly brain infection that affects 1 in 1,000 measles cases, causing brain swelling, seizures, and permanent disability. Subacute sclerosing panencephalitis, also known as SSPE. This is a rare but fatal brain disorder that appears years after infection, leading to memory loss, seizures, and coma. Other complications include ear infections, which can cause permanent hearing loss, diarrhea and dehydration, especially dangerous in young children, pregnancy complications, increasing the risk of miscarriage, premature birth, and low birth weight. Because measles weakens the immune system for years, survivors often experience long-term vulnerability to infections, leading to increased childhood mortality in unvaccinated populations. What is the best prevention? The best way to prevent measles is immunization. The MMR vaccine for measles, mumps, rubella, provides 97% immunity after 2 doses and might have saved millions of lives worldwide. However, some people worry about vaccine side effects, which usually include soreness at the injection site, low-grade fever, and mild rash. Severe reactions are extremely rare, and the risk of complications from measles might be greater than any vaccine side effects. For those infected, there is no antiviral cure, only supportive treatment to relieve symptoms, fever reducers like acetaminophen or ibuprofen, hydration and electrolyte support, and rest and immune support. In severe cases, hospitalization may be needed for oxygen therapy or intravenous fluids. What supplements help, and how to use them? Certain supplements can strengthen the immune system and reduce measles severity. These include vitamin A, which is essential for immune defense and skin repair. High-dose supplements reduce measles complications in children. Vitamin C is a powerful antioxidant that supports the immune system and reduces inflammation. Zinc, which is a crucial mineral for immune function, helping to fight viral infections faster. Probiotics support gut health, which plays a key role in immunity and recovery. These supplements work best when taken consistently before infection to bolster immune defenses. What are the best natural remedies and how to use them? Natural remedies can ease measles symptoms and support recovery. Honey and ginger tea help soothe a sore throat and reduce coughing. Chamomile or peppermint tea calms inflammation and supports hydration. Turmeric milk, which contains curcumin, a powerful anti-inflammatory compound. Elderberry syrup boosts immune response and reduces viral load. Organic ayat meal baths relieves itching and soothes irritated skin. These remedies work best alongside medical treatment. In conclusion, measles is a highly contagious viral disease that spreads through airborne droplets, infecting nearly 90% of unvaccinated individuals exposed to it. The measles virus multiplies in the respiratory system, then enters the bloodstream, leading to immune suppression and severe inflammation. Once inside the body, it wipes out immune memory, increasing vulnerability to secondary infections for years. The first symptoms of measles often resemble a cold or flu, including high fever, cough, runny nose, and red eyes. A telltale sign is Koplik spots, which are tiny white lesions inside the mouth. Soon, the measles rash appears, spreading from the face downward and lasting nearly a week. As the virus weakens immunity, it can trigger life-threatening complications, including pneumonia, encephalitis, and permanent hearing loss. While no antiviral cure exists, supportive treatment, immune-boosting supplements like vitamin A, vitamin C, and zinc, and natural remedies like elderberry and turmeric can aid recovery. Without vaccination, measles outbreaks spread rapidly, causing devastating consequences. Strengthening immunity and consulting your healthcare provider about immunization are the most effective ways to combat this deadly disease. Thank you for tuning in to Levitas. Please share today's video with friends and family, comment, give it a thumbs up, subscribe, and hit the bell icon to receive notifications for future videos. Your support is appreciated. It helps us grow and create more content to empower your health. Remain tuned to Levitas for more expert advice on your health and fitness journey. So, stay healthy, stay happy, and keep going.